Hi, everyone. Thank you for joining us. We'll get started in a few minutes once people have had a chance to join in, so sit tight. Okay, I think we can get started. Thank you everyone for joining us today for part 2 of our webinar series on safety guidance for the arts. We bring you this series as part of a collaboration between the Center for Emerging Pathogens at USC and the arts advocacy organization, Californians for the Arts. The focus of today's conversation is youth programs and the specific challenges they face as we all continue to live with this pandemic. Just a couple of housekeeping items. For the Q&A portion, you can submit your questions in the Q&A section below. And also a quick disclaimer that the information shared during this webinar is intended to provide general education, observations, and public health strategies, and any portions thereof are not to be construed as medical or clinical advice. All right, my name is Meline Aleksanyan. I'm the program administrator of the Center for Emerging Pathogens at USC, we'll refer to as CEP. Representing Californians for the Arts, we have Kara Smith, who serves as manager of programs and organizational advancement. Our panelists today are Dr. Neha Nanda. She is the founding director of CEP. Jonathan Zeichner, who is CEO of Los Angeles-based youth organization, A Place Called Home. Carol Tang, who is executive director of Children's Creativity Museum in San Francisco, and Matt Carney, who is executive director of San Diego Ballet. As a brief introduction to CEP, we're an organization, a center at USC. We work with organizations both here in the States as well as internationally to provide guidance in all infectious diseases. So COVID has obviously taken center stage and stolen the spotlight in recent years, but we try not to forget all other infectious diseases. And this is especially the case for international organizations we work with, where vulnerable populations are plagued by many infectious diseases that a lot of times we in the States don't have to think about. So one of our collaborations in the States has been with Californians for the Arts. I'll let Kara introduce the organization and the advocacy work they do for the arts. Kara?
Thank you so much. Good afternoon and welcome everyone. As Mel mentioned, my name is Kara Smith and I am the Manager of Programs and Organizational Advancement for Northern California with Californians for the Arts. My pronouns are she, her, hers, and I am joining you from Nisenan and Miwok lands, also known as Sacramento. And I want to invite our guests too as well to utilize, in addition to the Q&A for your questions, to use the chat box to say hello and let us know where you are joining us from and what organization you are with or what brings you here this evening. So again, welcome. Californians for the Arts is the only comprehensive multidisciplinary organization focused on advancing and building public awareness of the value and impact of arts, culture, and creativity across California. Californians for the Arts helps artists, arts organizations, and creative workers to stay connected, informed, and to grow as local arts advocates. Our partner organization, California Arts Advocates, is a 501c4 organization dedicated to being a voice for the arts and culture sector across the state through engaging in direct lobbying for state funding, policies, and programs that support arts workers and organizations. And all of our programs like this evening are free, but we do ask that you consider joining our organizations as a member. The goal of this series is to help those who work in the arts, culture, and creative industries be prepared to reopen programs and venues safely with the most up-to-date and scientific-based information. So we're thrilled to be collaborating with CEP on this. Tonight is a focus on youth programs, as Mel mentioned, and we're very, very grateful to our panelists for being here and participating tonight. And we're excited to be discussing mitigation strategies that will help the arts community at large understand best practices and to be hearing directly from these arts leaders about their successes and challenges. And I just wanted to mention that this is a part of a three-part series. We did have a previous conversation that was recorded, safety considerations for the arts, and it is available to view on our website. Tonight's conversation will also be recorded and available for viewing in a couple days. And our next program will be on December 15th, where we will focus on best practices for artists and venues, and we hope that you will register to attend that event as well. So with that, I will move on I'll turn it back over to Mel so we can continue this conversation tonight, and really looking forward to engaging in this discussion.
Thank you so much. The way we'll do it, we'll go through each panelist and we'll have them each speak about their organization, introduce your organization, and talk a little bit about the challenges you face and what your experience has been with the pandemic. We'll start with Dr. Nanda, who will give us an update on where we stand with the pandemic. Dr. Nanda.
Thank you, Mel. Did you say I have to introduce myself a little bit again? Or we are, okay, I do. Okay, thank you. Thank you so much for joining us. It's been very nice working with our partners here. And a little bit about CEP that Mel already touched on. You know, it's been actually very, very gratifying, the journey. Being able to work with places in Africa, places in Asia, and be able to support efforts that UNICEF or WHO is sponsoring. That's been our theme under the auspices of CEP at USC. And more recently, like Mel said, I mean, COVID has stolen the spotlight. And in that, we worked with the cultural sector and also, you know, educational sector. And we have worked with a place called Home, where Jonathan here has graciously agreed to join us and share his perspective. With that, I think I'll get into a little bit of an overview. This is a very general overview of where COVID is. I'll focus more on the country. Understand that, you know, I think one thing we've learned from this pandemic is that globally, we are very interconnected. You cannot ignore that. I say this because I recall in summer when schools were open, everything was going great. in the Indian subcontinent, Delta was just taking over. Infectious disease physicians, I think we knew in our heart of heart what's going to happen, but you were just so tired of being a pessimist. You wanted to think there's just light, not at the end of the tunnel, that we were a part of that light now, and it's not going to, it won't show its face, but it did. So where are we today? In our country today, at this time, we are seeing, this has happened in the last 10 days or 14 days, we've seen an 18% increase in cases. And there is a lag, as you know, with deaths and with hospitalizations. At this time, we are not seeing that. But what you are seeing, there are pockets across the country. If you're familiar with the CDC transmission level map, it's kind of getting to be purple and it's getting red. And red is the highest level. That's the high transmission. Majority of the country is in high or substantial. And that's basically defined by numbers. When you're more than 100 per 100,000 people, it's considered high. Next is substantial. Next is moderate. Majority of the country is high or substantial. Some places have moved from substantial to high in the last 10 days. Now, if we just look at California, we are fortunate in the sense that our vaccination rates have been pretty impressive. And these are some numbers that I think tell us what's happening in our state. The cases are down by 23%, though the cumulative cases are 4.7 million. And as you know, our population is 40 million. So there's a downward trend in cases, despite what we are seeing in some parts of the country. And with that, we also have not seen an upward tick in hospitalizations and deaths. Now, I don't know for how long we'll be able to hold on to this. And with all this, our vaccination rate, similar to what's in the country, it's in 59 to 62, whether you look at the country or you look at California as a state. Now, the reason why we are still with this virus is because, as I was taught during my training, you don't try and outsmart bugs. They'll outsmart you because look at the way they multiply. They multiply way faster than us, right? And they are going to outsmart you. And that's why we have a Delta variant circulating, which is very contagious, as you know, about 2 times more contagious than the ancestral strain. So that's why today, as we are getting into the holidays, Thanksgiving, and then winter holidays and Christmas, if you celebrate Christmas, I think it's really imperative for us to, if you're vaccinated, great, go get your booster. There are some states that have already allowed for boosters, while CDC is also thinking about it, and they'll probably give their authorization or their blessings. Get your booster. Let's stick to all mitigation strategies that we can feasibly do, along with let's enjoy the holidays. Mel, I could keep going on, but I'm going to stop and I'll let others chime in.
Yeah, so Jonathan, would you like to give us your perspective on your experience, what it's been through this pandemic and the challenges you face now?
Sure. Yes, thank you. It's good to be here with all of my colleagues, and thank you to the organizers of this event. So a place called Home is a community center, a hub in South Central Los Angeles, and we're a place-based organization. We have a campus there, and pre-COVID, we would have up to 400 young people a day, 8 years old into their mid-20s, coming to the campus for services and programs, plus wraparound for families, so parents, grandparents, guardians, lots of interaction with the community around us, very porous, also hosting community events, distributions of food and other kinds of essentials, toys and concerts, cultural events. We have a theater. We're a multi-service organization, which provides services and programs for education, mental health, nutrition, urban agriculture, college pathways, and vocational, but also the arts. The arts are a big part of a place called Home. We essentially are the equivalent of a number of small arts organizations under one roof. So we have a dance program with a dance studio and a dance company. We have a music program that teaches about 20 different instruments. We have a recording studio. We have a digital media program, a fine arts program, and a theater program. And so you can imagine that on March 14th of 2020, when we had to close the campus to all of these young people and families, it began a new era, really, for the organization as well as the world. And what we did is we pivoted very quickly. We were fortunate to have in-house capacity to essentially remake our entire portfolio online. And so to the point that now we are providing over 100 online classes each week, including dance classes and art classes and theater. We've done theater productions online over the past year and a half. We've done dance recitals, music recitals, and we added a number of special programs to provide our families and our young people with support for their urgent needs, food distribution, help with rent and utilities, and so on. Of course, one of the most important impacts, which I'm sure everybody here on the panel, but also watching, will probably nod your heads to as I say it, is our staff. How has this impacted the people who provide these services and programs? And how have we as employers been able to respond to and get ahead of that curve, deal with the mental health issues, the kinds of fear and apprehension, and the actual health issues? A number of our staff have had people get sick, have gotten COVID, not at APCH, but elsewhere. I lost a brother to COVID. Probably 2/3 of our families have seen an impact in terms of income, food security issues, rent, utilities, all of these things. So it's huge. I won't go on any further because this is the introduction, but just to give you a sense that APCH is a multi-service organization. We intersect with our constituents in many, many different ways. And COVID, there have been some silver linings. And one of them is our investment in technology as really the great equalizer, and recognizing that the digital divide is more than just a catchy phrase. It's an issue that we must deal with. It's an imperative. And then there's the health issues, the mandatory vaccination, the protocols, the infrastructure adaptations that we've had to make, the costs of all of those things, how have funders responded, the great resignation. I mean, all of these things that APCH and all organizations are being impacted by. So I look forward to getting in a little deeper, but I hope that gives you a good overview.
Absolutely. Thank you. Carol, please go ahead. Tell us a little bit about your organization.
Hello. Nice to see so many people on this call today. I'm Carol Tang, and I'm the Executive Director of the Children's Creativity Museum in San Francisco. I'm also a board member of the Association of Children's Museums, and there's several of us museum directors, and some of us who are on the call today, who meet every other week to talk about, how we're surviving and our mitigation. So I think on behalf of many children's museums and science centers and interactive museums, this has been, truly devastating, and also helps us focus on what we're really about. Many of us in the children's museums are almost pre-adapted. Like even before this, we are really concerned about washing hands, keeping staff safe, keeping staff vaccinated with the flu. We know our non-toxic cleaners like no one else, right? So we, in so many ways, were already prepared and had been thinking about health. I know when I became an executive director, it was when the measles outbreak happened at Disneyland. And we completely looked at our cleaning and our protocols and how we talk to families who were nervous. So again, we've been really thinking about health for a long time. And even in our sector, we've been greatly impacted, partly because it was unknown as as we just talked about, we weren't sure whether fomites, whether surfaces, what were the transmission, and also just the ongoing worry about no vaccines for children under 5, especially those still haven't come out yet. So I think that we recognize that it's been very prolonged, and maybe in many ways we've been hit harder than many of the cultural organizations, our fellow museums. While many museums were able to reopen earlier, and even some at the end of last year around the country, I've been looking at our museum more like a family entertainment center. So when we looked at what the state was putting out in their guidelines, yes, we're technically a museum, but really we're more like an arcade. We have hands-on interactives. We have an animation studio. We have a music studio. We have design challenges. It's more like a hands-on arcade than it is like a traditional art museum. So we've had to really go with our own rules and have a hodgepodge of looking at what safety things were. So again, I've been using family entertainment centers as my model, and we didn't open until it was safe for them to open indoors. So my museum actually stayed closed between March, as we mentioned, all the way to Memorial Day of this year. And even now, when we can talk about this later, when we get into the questions and answers, but I think that, we can talk about HVAC and all those fun things we've all learned. We didn't know we would need to learn this year. But I would say the two things that really impacted our sector the most in my museum specifically, one is looking at mission. Our mission is to nurture creativity and collaboration in children and in all children and families. So to nurture creativity and collaboration in all children and families. And that is very hard to do when they're socially distanced and masked. We've always thought about how do we get families to play together. And this past year, we're trying to figure out how to separate them, how to have different train tables and different things that they're not sharing. And those is exactly diametrically opposed to what our mission is. So I think that is a real big challenge. And the second one, as we said, is just thinking about, the equity and thinking about how we include everybody as this prolongs. And in some ways, the longer it goes on, the more disparities we're seeing and how the impacts of this on the family and our economics and so on are more exacerbated as this goes on. So I say those are the ongoing challenges. And again, all those other things we can talk about as well, hand sanitizers and masks and things like that. But I think thinking about how we're going to recover when the perception of safety and being distanced is going to be in people's minds, I think is the real challenge for not just our museums, but also just for society in general. So thank you.
Thank you, Carol. Yeah, we'll definitely be getting into a lot of the mitigation strategies in more detail. Next, Matt Carney from San Diego Ballet. Please go ahead.
Thank you. Good evening, everyone. I'm Matt Carney, Executive Director of the San Diego Ballet. My pronouns are he, him, his, and I'm calling from the Kamaya lands here known as San Diego. Just thank you to Mel and Dr. Nanda for organizing this along with the staff at the CFTA. I think this conversation is an example of a good thing from the pandemic, this sort of cross-sector collaboration. So really great to see these entities working together. I'll speak a little bit through the production lens, even though we have a school and everything like that. I see, Jonathan and Carol, they have those perspectives, but, really from doing shows with people of different intergenerational ages and audiences. I think in general, artists were creative thinkers. So in my art form, dance, to get from over here to over there, we'll come up with a creative solution. So we've been using this pandemic has been really a manifestation of how flexible are we? How can we really stay current on the current culture of what's around us and be responsive to that? I think when we're thinking about productions and strategizing, how can we bring people together? We've gone a mixed approach, of course, online and doing that sort of stuff. But I think, we're really thinking about how can we train the audience to be comfortable, to go out and convene in some way. So we've done a mix of indoor and outdoor productions, outdoor being the pathway to indoor productions. We had a drive-in version of the Nutcracker. And then we just finished a couple runs of outdoor shows where people were social distance and outdoors in a way that was safe for everyone to convene. And now we're really thinking about and plan to do an indoor production of what is our largest production of the year, which is our Nutcracker. We're dealing with 3 different strategies: our adults that are our employees and performing, the students that are involved and in part of our school, and also the audience. So for our employees and staff and teachers, everyone is required to be vaccinated. That was hard for me as the executive director to make that decision, that requirement. It just brought back some memories or some ideas of, testing for HIV and providing, requiring those tests. And is it equitable? Is it right to ask people to be vaccinated? All these sort of things we had to go through with some of our think tanks to see how can we make this a policy. What turned the page for us was just doing some research on industry standards, what unions are doing. And it was an article about the production of Hamilton on Broadway, where they brought up the simple fact that when we're in dressing rooms, social distancing is not possible. So if we were Google and we're working in cubicles and things were safe, maybe requiring vaccine wouldn't be necessary because you could be masked and you could still adhere to social distancing. So for our organization, even though we're able to be masked, we are unable to adhere to social distancing at all times. So that's why we made that policy. The students are not required, but we're still requiring them to wear a mask. And then our audience will have to be vaccinated or provide a negative COVID test within 72 hours of seeing our production. And we just also implemented having on-site rapid testing available for the show. So they have that available coming in. I know we'll get into some of this in more detail. And, I think that those safety elements of assessment, questionnaire of symptoms, taking temperatures, masking, social distance, and hygiene. These are the 4 pillars of all of the decisions that we're making for all of our programming, and making sure that that is our standard going on. But I think it's important that we carry on and move forward and do the best. And to Dr. Nanda's point, not to be a pessimist, but I think we thought, oh, we're going to get through this COVID thing and get back to normal. But I think now we're sort of flipping the script to understand, how can we proceed forward now and make these the policies for the future? And we can go deeper later. Thank you.
Thank you, Matt. Yeah, that's one of the bigger things, right? Part of the title of this series, Living with the Pandemic, and forgetting the notion that we're going to be going back to normal anytime soon, hopefully one day. But one of the issues you bring up with vaccination, like with the mandates and the hesitancy that's involved with, not just kids, but adults as well. I think this is a good time, Dr. Nanda, if you can get into the state of vaccination, the EUA that was passed for younger age groups and the efficacy of vaccines for those age groups.
Yeah. And I'd also like to say, Matt, what you touched on, that we can't stop. Normal operations, it's a new norm, has to continue. And therefore, I think Mel pointed out, it's living with the pandemic. And it's an endemic state that we are going to get to, and acknowledge that it is still a formidable disease. It's not influenza. It does have this long COVID associated with it, along with the other adverse consequences. And with that, we have it today. COVID is a preventable disease, right? And that's by virtue of the vaccinations that are available to us. And really, anybody who's 5 years or older is eligible and can prevent this disease, at least severe disease. So let's talk about the age group that we are here discussing more about. So more recently, Pfizer received an approval for age group of 5 to 11 years. And I'll tell you, to be honest, it's lukewarm, the response from even my own peers, my own social circle, because of, and I'll acknowledge that it is because of misinformation that's out there. And here I want to take this opportunity to just state some facts that are based on science and period. It's not my opinion. So what was the study? What Pfizer did, okay, first of all, these are mRNA vaccines, okay? What happens with the mRNA in our body is our body undergoes a dress rehearsal, as though, actually it's apt, I didn't think about that. I've used this analogy, but yeah, it's like a dress rehearsal, as though you are challenged by COVID, but it's only the COVID protein that your body is seeing. Okay, and that's the mRNA is the code for the protein. That's what's injected in our body. And within hours, it degrades after it's done what it has to, after our body has seen it and kind of mounted an immune response. So relatively harmless, the mRNA vaccine. The other vaccine that we have, AstraZeneca, J&J, AstraZeneca not in this country, those are very similar to traditional vaccines. So one shouldn't be concerned about their adverse effects that have been associated with it. And I'll touch on that as well. So let's talk about 5 to 11. Pfizer looked at around 2,200 students, not students, children, 5 to 11. And it was amazing what they saw. They looked at how many kids developed disease. And what they found was the vaccine efficacy. You always call it efficacy when it's in a trial. When you see the numbers in the real world, you call it effectiveness. So what they saw, the efficacy was 92%. That's impressive. And what were the adverse events? Fever, sore arm. No patient in their study, kids, no subjects in their study of 5 to 11 developed myocarditis and pericarditis that we've been hearing about. That's inflammation of the heart. So for this age group, it's relatively safe, okay? Now let's talk about age groups as you move up. So this is 5 to 11. Now let's talk about 12 to 15. And then there is 16 to 17 and 18 to 24. The reason why I'm dividing them in these categories is because I want to focus on the most feared adverse event. That's the inflammation of the heart that everybody's concerned about. In fact, I have 2 friends who I have to call once I get done with this because they have to get their girls vaccinated. And they want to be sure that, you know, they are not, they know all the numbers, and here are the numbers. So the background incidence of myocarditis and pericarditis is anywhere from 0.2 to 1 person in million people, 0.2 to 1 per million. This is background. This is in the absence of COVID, you know, because myocarditis is also caused by viral diseases, you know, Coxsackie, et cetera, et cetera. Okay, so 0.2 to 1, let's just say it's 1, okay, worst case scenario, per million people. If you look at the age group of 16 to 17, the incidence is the highest in boys. First, let me preface, it's almost 10 times higher in males than in females, the risk of myocarditis and pericarditis, for reasons that we don't fully understand. The highest incidence is in 16 to 17. It's lower from 12 to 16. 12 to 15. The data for 5 to 11 is still not there. So let's go down to 12 to 15. Okay. It's around 40 people per million in 12 to 15. 16 to 17 age group, you're talking 70 per million, 70 cases per million people. And then when you go to 18 to 24, again, it's around 40. And in the background, it's anywhere from 0.2 to 1. I don't recall if it's 0.2 or 0.6. So let's just say it's 1 per million. And in girls and females, it's 10 times less. So let's do the math, right? It's pretty straightforward that the risk is so much lower, because also know the myocarditis that we have seen, and this comes out of studies and our experience, what we have seen that occurs after vaccination, you see it typically after the second dose, you see it typically within 7 days, and most of the children have recovered by week 2, that's 10 to 14 days, and by 3 months, everything is back to baseline. And when I'm saying back to baseline, that's by doing the echocardiograms and looking at the heart function. It is a relatively mild myocarditis that people are getting even after the vaccination, even if they're the highest risk between 16 to 17. Mel, I think I talked a lot. So I'm going to stop. Okay.
No, we need that perspective. On the topic of vaccines, Jonathan, can you speak a little bit about your organization's efforts to combat hesitancy in the communities that you serve?
Yes, indeed. So the majority of the constituents we're serving are Latinx and African American, and many of the parents and the families that we're serving are monolingual and have not really attained more than an elementary school education. And of course, they are the leaders in their households and in their families. So initially, what we saw was access and information kinds of issues, and that was about everything. It was about just protocols, safety protocols, and masking, and learning about the virus and how to respond. And so we added a whole lot of education, bilingual education, into the communications that we were sending out. We've been doing a weekly bulletin now. We've given out all kinds of electronic devices to families just to get the flow of information and education going and communication. Now, once the vaccine came onto the scene, you started encountering some additional issues that folks may very well be aware of. Some of it is cultural. There's a general mistrust. I would say more in the African American community, a mistrust of the government, a specific mistrust around medical procedures. There's a horrible, shameful history in this country of experimentation being done on people of color, and specifically African American folks, and that has had a residual impact. And it's fascinating when you look at the analysis of who is resisting, and who is responding, and it doesn't always follow the lines that you might think in terms of educational achievement or anything else. So these cultural and historical kinds of factors run very, very deep. And then I think there's also religiosity. And that is an important factor, especially in communities of color, where if you have religious leaders who are resistant to or opposed to vaccination, they're impacting, and influencing hundreds and thousands of people. And again, the adults are the leaders in their households. So the kids are following the adults. Now, on the other side of that, you have the school districts, and you have commerce, and you have the fact that many people of color and low-income folks are working on the front lines and in service professions and working in hospitals and restaurants and all kinds of home-based businesses, et cetera, et cetera. So all of those things, I think, have aggregated to a crisis, a real crisis in the community that we're serving, because vaccination rates initially were quite low. There was a lot of resistance. That's changing now, and especially among the elderly, which is really great because they are also leaders in their households and in their communities. But now you have the other side of it, which is the attempts to get young people who are going to public schools vaccinated. And the Los Angeles Unified School District, as you all probably know, has mandated the vaccine for students 12 and up starting on January 10th of 2022. So we'll see what happens. But in the meantime, you've got burned out teachers, burned out administrators, some of whom also don't want to get vaccinated, or who are just really overwhelmed by the additional layers of expectation in terms of what they're supposed to be doing and communicating, and what happens when you do go back, because the schools are back in session, and somebody gets sick, and there's a classroom of 30 kids and somebody tests positive. So now you have kids going on quarantine, and parents who have gone back to work, and childcare is an issue. So all of these things. And I'll add one more thing, which I think is really interesting in the educational sector. One of the things that we're seeing is that African-American families are saying that during COVID, when all the kids were virtual, it actually equalized the treatment that their kids were getting by the schools. So there is a notable, I would say, percentage of African-American families who do not want to send their kids back to school physically, because they feel that their kids are getting better treatment and better respect virtually than they got in person. Now, the reason I bring that in, along with some of the other historic influences, is that this is not just a medical issue. You know, this has become a societal and social issue, and you have to overlay George Floyd and all of the things that came about in the past year and a half that have really, I think, shown a spotlight on inequities in our society, and so many loose ends and chickens that are coming home to roost in this country and in the world. So I don't want to get into a big tangent, but I do want to say that this is a complex issue. It's not as simple as educating people. It's not as simple, I hate to say this, but it's not as simple as verifying scientifically, what makes sense. We're dealing with many intersecting issues and belief systems. And it's almost like a civil war, because you have families that are divided. And my family is one of them, not my immediate family, but I have a brother and all his children, they will not get vaccinated. And my brother's brother died from COVID, and he will not get vaccinated. So I don't have answers to all this, but what I can tell you is that what we're doing is trying to create safety, trust, accessibility. And in the case of our employees, we mandated the vaccination. We had some employees who pushed back, but when push came to shove and we said, we cannot accommodate you, we respect your beliefs, and we can exempt you from being vaccinated, but there's no place for you to work here because you have to work with kids. And they got vaccinated. So that's the other thing, is the dynamics around, we're seeing it with the police and the fire department and first responders and all kinds of folks. What happens when push comes to shove? And the politicization of all of this stuff, right? Which is odious, but it's real. I don't know, I went on a bit of a tangent. I hope that answered your questions at least a little bit, Mel.
No, absolutely. I of course, the pandemic has revealed a lot of truths about our society. And, to begin with, everything has already been so complex, especially for organizations working with and for youth. And now we're faced with that, the youth being, partially vaccinated, some ages not yet. And so that definitely adds to the complexity of it.
Yeah, and I should just add that we are following the LAUSD mandate. So we have let all of our families know that as of January 10th, it's actually the 18th for us, all of our 12 and up members need to be vaccinated to come back on campus.
Mm-hmm.
And we will follow LAUSD as far as the 5 to 11-year-olds as well, because if we don't follow them, it creates a conflict that is almost unresolvable for the families. And it puts us in the position of having to deny people, entry and all of those kinds of things. So that's our plan, is to follow the school district.
Mel, if I can add to what, Jonathan, what you shared with us, that caught my eye too, how they realized the people of color felt better being remote rather than in person. I think people had narrated their experiences. I've always wondered, since now that has been brought to surface, I wonder if we did a post-awareness study, if there's going to be more, more leveling and people of color would not feel that way. I don't know. Because we know in person is better than, remote.
Well, just very briefly, what I will say is that just as all crisis does, and it's really almost the only thing that does this with human beings, it is pushing evolution. And so in terms of response to these very issues, yes, there are more programs, there's more awareness, there's more understanding. Organizations everywhere are doing their DEI work. We call it our JEDI work at APCH. And that will have an impact. This is a moment of awakening, and it is already having an impact, and it will continue to, and we must seize this moment. So I say things are going to get better, but mistakes will get made. People will be harmed. People will be left behind. That's the nature of it. But don't ever waste a good crisis, right?
John, you bring a lot of good, deep things up for us to think about. But I wanted to jump in with a follow-up and to Mel's original question to you, and ask something similar of Carol and Matt. And in your organizations or your field, have you also felt like you need to take up the role of educator, an information disseminator about vaccinations or about COVID-19, either internally with your staff as you must consider, weigh, and mandate vaccinations, or with your audience and your constituents at large? And if so, how have you approached that?
I could go first. My team and my board and I, we were really revved up to do this work, to, feeling, so our visitorship, we have about 100, before the pandemic, we had about 120,000 visitors a year to the museum, another 250,000 to the carousel. And our audience is over 2/3 non-white, and we have a lot of, 25% came who are low income, come for free. So we really wanted to do this work. I am a scientist by training, and so I really wanted to. And we're still geared up to do that. We're just very lucky, I'll say, in San Francisco, 95% of children between 12 and 18 have already become vaccinated. I think 30% of 5 to 11-year-olds have been vaccinated since it was approved. So we almost have a very little chance to do that. Same thing with our staff. I thought that we were going to talk about this and so on. And when educators were given the okay to get the first vaccinations and then the booster, the team went out and did that on their own. So again, we were ready and have been, there's great information from a lot of the museums. Some of you know, American Association of Museums, American Alliance of Museums, the Association of Science Technology Centers has been giving out mini grants to museums to do this work. And again, we're just very lucky in San Francisco, we haven't. Who I have been helping with are families and visitors from Southern California who come to the museum and ask me about, they said, we heard that it's really strict up in San Francisco, and they're very respectful. It's a great conversations. And we just have just casual conversation at the door about masks and vaccines and, what do I think? And just very informally. And it's been really wonderful to be able to have those informal conversations. So I do feel like we're trying to do our part. And again, luckily, we haven't had to do a lot of heavy lifting. I'm sure as we have great organizations that have done that. I think as we're looking at booster shots, that's another one that I would just say is I do think that there's a role for those of us. I think that people have not been getting the booster shots. And these are, again, people who already were vaccinated. So that's where I do think that having some more information from CEP and others would help us get the word out. These are not people who are vaccine hesitant, but who don't have enough information about getting a booster shot. So again, I still feel really good that there's going to be a role for us to do that. And I think so many of us are willing and able and have the audience and already the trust. As you know, museums have been voted one of the most trusted civic institutions left in this country. So I do feel like we can do this work, and maybe in partnership with CFTA and other doctors and medical health, we can really think about this next booster and living with the pandemic, and going beyond just that first, potentially scary thing for us to think about doing is confronting people who have anti-vaccination or very different viewpoints. But I think that there's a lot of people who just need a little bit more information for booster shots and kids' vaccines.
Great, Carol. That's great. Yeah, I think just to add to that, I kind of go back to what Dr. Nanda was saying, just that this is a dress rehearsal. There's this opportunity where, if the hospitals or the CDC or whoever's creating the marketing campaigns, that they're really involving artists as part of the solution and creating the materials or whatever that needs to happen to promote the vaccinations, maybe not through our individual organizations, but we're at the table to be able to tell that story. I think for us with again, dealing with staff, parents, and then the children, it's kind of that education piece plays different to that different demographics. I think we're adhering to, kind of like what Jonathan was saying with the school district policies, kind of not passing the buck, but making sure that we're in line with other institutions that deal with children, to stay steady and stay precise and absolute about some of those standards, not wavering. I think with our staff requiring the vaccines, we had a couple of staff members that were very apprehensive about getting that, and they would understand that they were unable to work with us moving forward. And, honestly, of course, I'm like, come on, what's the big deal, right? But, one of the staff members, of course, we've known and worked together for years, crying in the parking lot of the vaccine clinic. This is someone that was just scared, and it was just needed that nurturing or that support, that I think the education piece, it goes to kind of what Jonathan was saying too, about this, creating this safe environment, creating trust. And I think we're sort of entering into these categories of how we can holistically educate about moving forward in what is our standard right now. And, some of the parents we're dealing with, what we're finding, we are seeing some increases in our enrollment because there's specifically a niche, I think, where people want the kids to be in safe environments. So we're finding our adult classes, I know we're not talking about the children, but our adult classes are increased because they want to be in a safer environment. But some of the parents, those are the ones that we're having to work with, because it's not the kid's fault. Whoever's the head of the household is going to be making these decisions. And I just want to sort of pinpoint, something else I think about our work in working with youth, and even with mental health, depression, anxiety, that I think what we're having to do too is, on a real microcosm, I'm a guy, I'm over 6 foot tall. I go into a classroom sometimes and I have to sort of like be approachable, and without facial expressions, what do I need to do that the students feel safe? In my art, they don't have many experiences with male teachers, for example, but what can I do to make the students feel safe? And I think that's a lot of the stuff, even with or without the vaccine, I think that we're dealing with, is how can we really create these safe environments and building trust where that change can really happen. So, for us, giving specific breaks without masks outdoors, or, creating that environment where the students, the staff, that everyone feels safe. And I think that's where we can start having more of a dialogue.
Thank you, Matt. I actually was going to ask you about those mitigation strategies, so maybe we can shift the conversation to that topic. So the specific mitigation strategies that you have been focusing on, you talked about the 4 pillars as part of your production planning and operations at the ballet. Can you talk a little bit about those, the mitigations, and then how each one of them has impacted what you're able to do as an organization that's, giving so much to the arts community?
Thank you. It takes a little bit more time and effort, I think we're seeing, with capacity to sort of manage that. I think a lot of organizations are experiencing those type of issues. And I think that what we've been really focused on is just that, again, that pathway to making people feel comfortable with what are now the new protocols. We're having outdoor classes and then indoor classes with the windows open and masked, having outdoor performances so the audience can get used to even convening. You could see the anxiety of them going up to the box office, going to their chairs, moving their chairs to the side, just kind of giving them those opportunities to feel awkward in the space and make a mistake, and then kind of, giving them the space to sort of interact in that way. With the 4 strategies that we're doing, we are not testing. We've decided that that's not going to be a strategy for us. So what we're doing is doing the self-report questionnaires and the temperature checks, as we know that temperature is one of the highest triggers. I'm sure someone has a doctor word for that, to sort of know, that COVID is there. With the mask, providing the mask for everyone as needed, and keeping those social distances when we need to, and really making that the standard for people waiting outside or even in the classrooms. So I guess, sort of to answer the question, I just will probably just go back to that pathway. Our ticket sales, our capacity goes down, the number of tickets we're able to sell, but we're still filling as much as we can. So I think we're seeing a hit there, but I think it goes back to the safety and that trust building, that we have to see the long game here, that I think we can increase capacity over time once people are able to get used to the new protocols.
Thank you. Dr. Nanda, it'd be great if you could chime in on the mitigation strategies and kind of the hierarchy of these strategies for organizations to focus on. So starting from the most important.
Yeah, so I think if you think about it as a pyramid, what's on top is vaccination. And the reason why I'm putting some on top is because they are not behavior dependent. And as I kind of think about it, I'm going to put the things that are dependent on behaviors at the bottom. Okay, so vaccination is on top, optimized ventilation and testing if you have access to it. And I'm not saying go to the lab and get a PCR. I only wish we would have those antigen tests in abundance, which we don't. So testing, vaccination, testing, ventilation. And the only reason I haven't included masks there is because it's slightly behavioral, right? Because it's how do you wear the mask? And some people don't like to wear it. Then you think about mask after that, the next level. And then you think about other things that Matt alluded to, symptom screening. That's another thing. Now, let's take it to another, our theme being living with the pandemic. I'd like for us to also think about what are the things that are going to keep us safe and are going to be here for a while, are not going to go away. So just listening to everyone and seeing what's happening in different industries, vaccination is going to remain. If you have optimized your ventilation in your indoor space, good for you. Things that will come and go and will vary with the community prevalence is going to be how much indoors we want to be, how much masking we want to do, how often do we want to test. And I think maybe, Mel, this is a good time for me to just say a word or two about boosters, because Carol touched on it. So, you know, the scientific fact today, which is not the entire story at all, is that we have learned from Israel, we have learned from several countries across the world that after people were boosted, their protection went up about 40 points 6 months after. So you got your dose 1, then 21/28 days, depending on which vaccine you took, or 30 days, you got your dose 2. And if there's been a gap of 6 months, it drops from around 90% to, you're talking 40 to 50% protection against symptomatic disease. If you want to boost it up to 85% against symptomatic disease, that's mild disease, get the booster at 6 months. I'm talking only about people who are not immunocompetent. And just a last piece, that protection against severe disease that requires hospitalization, that does not seem to go down. You do pretty okay after you complete the first 2 doses. But, you know, it's that symptomatic disease that causes disruption in normal operations. So it becomes very important for us to rely on boosters. Mel, it's all yours.
Yeah, I think it's safe to say that the 2 layers that add to this very complex theme are the fact that a lot of these activities by kids, they're high risk, whether it's singing, dancing, you know, there's a lot of motion, there's sports, there's, in Carol's case, touching everything, since it's very interactive. And on top of that, we are dealing with a population where, you know, not all of them are able to be vaccinated, that very top strategy. Carol, can you share some specific mitigation strategies for these activities in your museum?
Sure, thanks. As I mentioned, I mean, flu and measles and other things, are very transmittable too. So again, I just want to emphasize that I think, we've been very careful, and this has forced us to be more intentional and really think through why, like we talk about, hygiene theater. Well, some of these things are not theater, so this is just good practice. So, things like we do have signs in the bathroom about how to wash hands, in terms of the surfaces, as we talked about ventilation, we did invest in higher HVAC, efficiency, as well as went to MERV 15. And the other thing for us is that we decided there were some rooms, because they didn't have windows and doors to the outside, that we couldn't open. We are only open at 50% capacity. We only opened up the spaces that could be open to the outdoors, that had fresh air. And that again is impacting our economics, but we just didn't feel it was right. We had another storage room that did have great fresh air, and so we cleaned it all out and made an exhibit space. So, really only focusing on the things that could have fresh air. And because we were worried, at least about, what if there was a case and we had to call everybody. So that's why many of us have stuck with reservations, thinking that if we had to trace, we could do it. So focusing on advanced reservations, and we cap our attendance so that there can't be too many people in the space, in the limited space we have. So we only have, for example, we're only open from 10 to 12:30, and then we clean to at 12:30 to 1:30, we close and give ourselves an entire hour to wipe every single surface. And a lot of our material, we're in kits, and so those kits will be taken away so that another clean set that has not been touched at all that day will come out. So it's a completely pristine set. And we know that, if it's left alone by 3 days, even if we didn't clean it, which we do, that it would be safe. And so I try to get my staff, for example, to not try to clean things until the day after, so so that, at least it's 24 hours before they're recleaning surfaces. If they're, it's very unlikely that there'd be on the surfaces, but trying to put in as many of those pieces. We hired professional custodians to come and clean at the end of the day. But the ones that I think, again, many of those were things that we were very cognizant of. We do a lot more, cleaning, keeping doors open so no one has to touch doorknobs and things like that. But I think the ones that are, just difficult in terms of economically is thinking about the different sessions, having sessions, cleaning in between, keeping it low, being only able to open the venues that have fresh air. Those are the things that we can't do forever in terms of trying to figure out how we're going to survive economically. And so, waiting for everyone to be vaccinated. But again, knowing that under 5, which is a main core of our audience, whether within a family or separate, it's going to be until 2022 at the earliest, and it won't be until mid 2022 before they're fully vaccinated. And so, and I guess we're not even sure whether 2 months and under 2 years and 6 months, whether there even will be one or what that vaccine looks like. And so I think we're facing challenges, again, just recognizing that those are going to be around for a while. Can I share some anecdotes about happy news though? Because of masks on at all times, most children's museums now no longer have food or drink because you have to take off your mask. And so many of us are thankful that there's no more goldfish crackers and all the carpets and toys and everything. So there are some of those rules that we will probably keep, good habits about no goldfish crackers and Cheerios in the children's museums, at least for some time. Or maybe we'll all celebrate when we actually bring them back again, and we'll actually appreciate Cheerios on the floor. So anyway, there are just some changes of habits that I think we're all going to have to embrace for a while, and know that, these are things that we were actually really careful of before. And like I said, almost pre-adapted to this. So in that sense, we're very, feel thankful that we had best practices already in place, and that we could just, be more intentional about it in this new world.
I suspect that sooner than later, you're going to be very nostalgic for goldfish cracker crumbs and Cheerios crumbs everywhere.
I think you're right.
Yeah. Dr. Nanda, can you chime in about testing strategies and how these can be incorporated into policy? So in the absence of being able to vaccinate everyone or have high compliance with vaccination because it's not available to everyone, how can organizations incorporate these testing strategies to make up for that?
So if an organization has access to rapid tests, utilize it to the best of your ability. And I think that requires just some strategy to increase the yield of the resources you have. So the antigen test, the advantage of that is that you can get a result in 15 minutes, right? And know that the sensitivity of it, that is the ability of it to pick up a positive test, varies in a person who has symptoms and in a person who doesn't have symptoms. And a person who doesn't have symptoms, the range is quite variable. It varies anywhere from 30 to 50%. So you could miss someone if someone who's asymptomatic. But if someone who's symptomatic, it suddenly moves to 60 to 85% chances that you'll pick up the person. Obviously, if it's a positive, you have to tell the person, go ahead and get your PCR to confirm it, unless the person already has symptoms. So if it's a positive, I say that you want to confirm with a PCR test that takes longer. That is what typically the county offers, is because there have been instances that you get a false positive antigen test. So just know that. But otherwise, that's a quick and a dirty test. You get the result in 15 minutes. Because the sensitivity is low, typically what people are doing is, like in some schools, they're going to up the frequency. They'll do it 2 times a week when the prevalence goes up. Or you just do it once a week when your prevalence is low. This is the antigen test. The other test that's really the gold standard, so to speak, in this pandemic is PCR. The challenge with that is turnaround time is about 24 to 48 hours. Having said that, if someone's negative, you know that that person doesn't have it, at least at that minute. What you don't know is, Does he have it 5 minutes later, or does she have it 5 minutes later? So you see, you have options to choose from. I don't know if you guys heard about this. I just heard yesterday on NPR, yesterday morning, that LA County is now training dogs it's a part of a bigger collaborative, training dogs to sniff COVID. I'm sure it's still in its nascency, but it's very reminiscent in infectious disease. There's a disease in the hospital called C. diff. There was a thought that dogs can sniff C. diff. So, and apparently they can smell your socks and tell you if you have COVID or not. And the people who are going to be recruited are people who have acute COVID within first 3 or 5 days. And you've got to wear those socks and get exposed to the dogs that are getting trained. But the reason I'm saying this is I think there's a lot in the works that'll help us down the road, because we have to live with it.
Thank you. I just want to remind everyone, if you do have questions you'd like to submit for the Q&A, we can get into that soon. Please do so in the Q&A section below. Meanwhile, Jonathan, I know that a place called home was utilizing testing as part of the strategies, and as well as the improved ventilation. Can you talk a little bit about how those strategies have progressed? Where are you now with that?
So the way we're doing it now, we have pretty strict protocols to come on campus. When you come in, you must have your temperature taken and do a test, nasal swab, and our staff is registered so that they do this twice a week, and it automatically goes to the lab and comes back. Visitors now must do it as well. We're not doing it with kids yet, but it's a possibility that we will. If somebody tests positive, and unfortunately we don't get the results back until the next day, but if someone tests positive, then we do contact tracing. We have cameras everywhere. Everybody signs in. We know where everybody is. We do contact tracing, and everybody who's come in contact with the person who tested positive gets a rapid test. And we have an arrangement with a local clinic that provides all of those, for our staff and for constituents in the community as well. So those are our testing protocols, and then we have mask protocols as well. And for guests, we ask them either for proof of vaccination or proof of a negative test. Does that answer your questions? Now, one thing I will share is that we're on our second lab. The first lab, the results just kept getting slower and slower. And so it really, became almost more like a liability, because you get tested and not get the results back for a week. And by then, if you were positive, you could have infected a lot of folks. So that's where we are right now with it.
Thank you. If any of the panelists have questions for each other.
Mel, can I ask Jonathan, is it, what's the turnaround time now? I know it was a week, like you say, a while ago. What is it now?
So we just started with a new lab, and if we get the test, I think all the tests that are done before noon come back the next day, and the tests that are done afternoon come back the following morning. Okay. So it's basically 24 to 48 hours, but it's seems like it's closer to 24 hours with most of it.
Yeah, as you said, it's all about timing.
Yeah, and here's the other thing: the rapid testing, which was free for a while, is now no longer free. Yeah. So that's a problem. We're actually having to raise money now to pay for rapid testing.
Okay.
Yeah, a lot of these strategies require so much of resources. I'm sure, it must take away from what you're serving a baseline to the kids.
You know, Mel, there's one other thing, and perhaps Carol, it may resonate with you. What we are seeing is there's when people, especially the students and perhaps the very young, they went out in the community, we started seeing a lot of other viruses, very frequent cough and colds. And, you know, that really confuses the picture. And that's why I really liked Matt emphasizing on symptom screening, because the truth is you tie in symptom screening. If you miss that, your turnaround time is 24 to 48 hours, as Jonathan mentioned, you have an outbreak. So I think having an overarching sick policy, at least for the time being, it should actually be forever, is very helpful, because a lot of rhino, a lot of enterovirus is circulating in the community.
And I would say it's also for staff, you know, again, I think, you know, a lot of times now we're talking about, you know, having, you know, separate teams and things like that. But again, we've always had this practice that, you know, is making sure that we have sick leave for staff so they don't feel they have to come in, that, you know, and this is again before COVID, and just recognizing that, you know, working with children, those of us who are parents know that, you know, that your kids are bringing home things from school. So just being even more wary of that to protect visitors and staff in general. You know, don't come in, you know, when you're sick, you know, when you're not feeling well, when someone is in your house is not feeling well, all those kinds of things. Again, you know, luckily for childcare and so on, it's been part of the best practices and daycare and after school programs. And again, you know, that we didn't have to invent all these things from scratch, just being more intentional about it when it came to COVID, for sure.
You know, I agreed, you know, the stakes have gone up and all this, but it raises a question I'd like to ask you, Dr. Nanda, which is, all of us who've been spending most of our time indoors for the past year and a half, how are our immune systems doing?
Yeah, so it's a very good question. And it's possible that we have, and also indoors, even when you are indoors, know that you're masked, right? You were not masked before. So yes, we have kept ourselves very safe, and it is very plausible. I say this based on a little experience with patients, you know, family, friends, that we are more susceptible to coughs and colds when we take our masks off, just because our system has not seen it in a while. And we are already seeing that in students. We saw that when schools were closed from March last year to, you know, December, Jan. That's how it was in California. We didn't see a lot of these other viruses. And now we are seeing, remember in the summer when camps were going on, we saw it all go up. And, you know, kids are going to be kids. They'll wear their masks, but, you know, that actually, there's another thing that has always kind of been in the back of my mind. You know, we talk about, Jonathan, did I answer your question? Sorry.
Yes, that was the question. And I'm not a doctor, but I have the same theory you do.
I don't think we don't need to be doctors. Everybody knows COVID. COVID is everybody's business. Nobody can escape it now. You know, the other thing that we talk about is when I even kind of put forth the hierarchy, you know, in that pyramid, I did not include physical distancing. And the reason I didn't is because it's just not logistically feasible, especially in the world that we are talking about right now. And if you really try and think about it, I've kind of reconciled to the fact that it's not so much distance, but it is more of it is density. And I say that because we have learned that this virus is aerosolized. By that, I mean, it's like you're inhaling someone who's smoking, right? You're inhaling the smoke. So even after the smoker leaves the room, you enter, even in his absence, I can contract the virus, right? So it comes down to density. And, you know, I'm not saying that don't do physical distancing. If you can, great. But something to keep in mind how important ventilation is relative to distancing. And I bring this up because I think some of us talked about that we've had to reduce capacity and that affects our, economic or financial sustainability. So something to think about.
All right, I think we can wrap up. I want to thank everybody for joining. Kara, did you have something to add?
Yeah, well, I wanted to thank everyone as well, but I also just wanted to acknowledge something that what I've heard here, which is the incredible resilience and impact of the arts in so many ways, and not just as spaces where you're affecting mental health, as spaces where you're educating and providing safe space, and also activities and entertainment, and how much it's come up that arts is integrated into solutions, and that it's just so important. So on behalf of the state's advocacy organization for arts and culture, I wanted to acknowledge how much I heard that tonight. And then maybe just as a takeaway, right, as we're wrapping up and saying goodnight, if there are any resources, so for those who might be listening in, who might run similar organizations, I've heard some tools come up already. I know, Carol, you're a part of a museum administrators group. And Jonathan, you mentioned kind of developing a relationship with a lab, like to help with testing, right? Are there other resources, either financial or just informational, as you have to become sort of very aware of COVID and its effects and such, that have helped you do your work with youth and pull off programs as best you can? And maybe that would be a good takeaway to close out on.
Go ahead, Matt.
Oh, thanks. Just real quick, thank you for bringing us together, and it's not necessarily a direct solution, but as we sort of look at funding sources and compartmentalizing health and human services, the arts, the environment, I think fostering these type of conversations and these collaborations are so important, so that we're not siloing where the money sources are, because I know this past year financially, honestly, wasn't so bad because we had so many federal programs and county programs and state programs that were helping us. So as we go into these next 2 years, definitely this next year, where we'll see a lapse in some of that federal assistance and state assistance, I think that all of us, the health and human services, mental health, and the arts, just calling out to sort of stay in touch and stay collaborative when we're doing our advocacy ask, to make sure that that we see the intersection of how health and the arts are so important for our culture, that we can unify our voices.
Yeah, I want to piggyback on that, Matt. I actually think that the biggest impact of the arts on all of this is yet to come, because the plays and the movies and the books and the paintings and the poems and the dance choreography that is being created right now, that is going to explode across the world and help us with processing, and not just understanding, but also accepting and figuring out, as artists always do, how you take adversity and create beauty from it and move forward, and embrace life, no matter what the hardships are. And the arts are what help us do that. And that's coming. It is coming.
In addition to those things that I certainly agree with, I can give you some more practical. I feel bad. Everyone has these great, grandiose ideas, and I have like how the virus stays on paper. But there are really good studies. The Institute of Museum and Library Services, there's a REALM project, REALM, where they tested how long COVID would stay on different surfaces under different conditions. And again, it may not matter as much for performing arts, but also seats and curtains and props. Those things do matter, and those are the kinds of things that were studied, as well as books and fabrics. So I would take a look at that as well. Thank you so much, Kara. And then and the last thing is just in terms of youth programming. really looking at the after school profession. So the National After School Association, the California After School Network, the CDE, California Department of Education Expanded Learning, they have a very robust set of materials. So thinking about not just COVID safety, but all the things that we talked about, SEL, social emotional learning. How do we help children grow and families become stronger and more resilient through this? Take a look at those kinds of resources that are already existing out there, How Kids Learn Foundation as well in Oakland. So I just encourage, this conversation. It's so wonderful to see so many people care about kids and art, and that, we're all in this together to try to learn from each other to help kids, get through this. And they're the ones that, we're doing all this work for them to make this a better society for them. And so thinking about the other kinds of allies we have outside of arts and cultural institutions and looking at youth development and community centers as a way to do that. So thank you so much for organizing today's session.
And I'll also say that we're also grateful for science. Arts and science are formidable partners. So thank you, Dr. Nanda and Mel, for the work that you do and for partnering on this program, in addition to our amazing panelists. So with that, Mel, I'll hand it back over to you to say goodnight.
Yeah, absolutely. It's been a wonderful collaboration, and it's so great to have this platform where we can bring different perspectives and, the arts, the community organizations, the dance, the music. So I'm really grateful for this collaboration. And I want to thank all of our panelists, Carol, Jonathan, Matt, thank you so much. And Kara, thank you. And Eddie, thank you so much for keeping all of this together. Don't forget, everyone, to register for the December 15th, part 3 of our series. That will be the last part, and the focus will be venues and performers. With that, thank you all. Have a very good night.
Thank you.